Imagine this. You're walking through life feeling fine, maybe just a bit tired or foggy here and there. You brush it off as stress or lack of sleep. But what if those little things are warning signs of something much more serious? High blood pressure, also known as the silent killer, affects nearly half of US adults, and many don't even know they have it. Left undetected, it can lead to heart attacks, strokes, and even kidney failure. But your body often whispers before it screams. In this video, we're uncovering 10 early signs of high blood pressure that you should never ignore. Some of them may surprise you. Stay tuned. You could save your life or someone else's. Number 1, frequent headaches. Persistent headaches, especially in the morning, can be one of the first subtle signs of high blood pressure. These headaches aren't always severe but are often dull and consistent, typically felt at the back of the head. High blood pressure increases the pressure inside your skull, which can irritate pain-sensitive tissues. While headaches are incredibly common and often tied to stress, dehydration, or poor sleep, those with hypertension-related headaches report them occurring more regularly, particularly when blood pressure spikes. If you notice an unusual pattern, like daily headaches when you wake up, it's worth checking your blood pressure and consulting your doctor. Number 2, blurred or double vision. Your eyes are surprisingly sensitive to changes in blood pressure. Blurred or double vision can occur when high blood pressure damages the blood vessels in the retina, leading to a condition called hypertensive retinopathy. You may not notice symptoms right away, but as the damage progresses, vision changes become more noticeable, especially at night or during high-stress moments. Some people even experience temporary vision loss. Because this sign is subtle, it's often mistaken for eye strain or aging. If you're struggling with visual disturbances, especially if they're new or worsening, get your blood pressure checked immediately. Number 3, dizziness or lightheadedness. Feeling dizzy or lightheaded regularly may point to blood pressure that is dangerously high. This sensation can stem from the brain not getting enough oxygen-rich blood due to narrowed arteries or blood pressure spikes. Some people feel unsteady on their feet, others feel as though the room is spinning. While these episodes may be brief, recurring dizziness should never be brushed off. It's also a dangerous symptom, as it can lead to falls, especially in older adults. It's important to differentiate between dizziness caused by motion or hunger and one linked to cardiovascular problems. If you feel off balance or disoriented for no clear reason, it's time to have your blood pressure evaluated. Number 4, nosebleeds. While most nosebleeds are harmless, often caused by dry air or irritation, frequent or unexplained ones can be tied to high blood pressure. When blood pressure spikes suddenly, it can rupture the delicate blood vessels in the nose, causing a bleed. These bleeds are often heavier and harder to stop than the occasional dry nose drip. If you're experiencing recurrent nosebleeds, especially alongside other symptoms on this list, it's time to get checked. A one-off isn't cause for panic, but a pattern is. The body often gives us subtle warnings. We just need to listen. Number 5, shortness of breath. Do you feel winded after climbing stairs or walking short distances? Shortness of breath can indicate your heart is working too hard to pump blood, often a result of high blood pressure. Over time, hypertension thickens the heart muscles and stiffens the arteries, making it harder to circulate blood effectively. This leads to fluid buildup in the lungs, which restricts oxygen intake. In severe cases, this condition is called congestive heart failure. Even mild breathlessness can be a signal that your cardiovascular system is under stress. If this happens regularly, especially without physical exertion, seek medical advice. Number 6, chest pain or palpitations. Chest pain is one of the most alarming signs your blood pressure may be too high. Hypertension can strain the arteries and heart, causing tightness or a pounding sensation. Some people describe it as a fluttering in the chest, while others feel a sharp pressure. These sensations are caused by the heart struggling to pump against resistance. If you experience chest pain accompanied by breathlessness or dizziness, it could signal an impending heart attack or stroke. High blood pressure damages your arteries over time, and chest discomfort is your body's red flag. Don't wait. Get help. Number 7. Fatigue or brain fog. Unusual fatigue or brain fog, difficulty concentrating, forgetfulness, or a sluggish mental state can also result from elevated blood pressure. Hypertension may reduce blood flow to the brain, impairing oxygen and nutrient delivery. Over time, this can even contribute to cognitive decline or increase your risk for dementia. Many people dismiss these symptoms as aging or stress, but when combined with other warning signs, they're worth noting. If you're sleeping well but still feel constantly drained, don't overlook the possibility of high blood pressure. It's a quiet disruptor. Number 8, blood in urine. Seeing blood in your urine, also known as hematuria, is alarming and should never be ignored. It may indicate damage to the kidneys, which are critical for regulating blood pressure. High blood pressure can cause the blood vessels in the kidneys to rupture or inflame, resulting in leakage. You might not always see the blood, it could be microscopic, but routine tests can detect it. If this happens more than once or is accompanied by pain or pressure in your lower back or sides, it's vital to get medical attention immediately. Protecting your kidneys means managing your blood pressure early. Number 9, pounding in chest, neck, or ears. A rhythmic pounding sensation in your chest, neck, or ears could indicate your heart is working harder than usual. This sensation often coincides with periods of elevated blood pressure, especially during stress, exercise, or caffeine intake. You might notice it lying in bed or sitting still in a quiet room. While it may seem harmless, it's another indicator that your cardiovascular system is under pressure, literally. Don't wait for a heart event to validate your symptoms. Take it seriously and track your blood pressure during these episodes. Number 10, facial flushing or redness. Have you ever noticed your face turning bright red during stressful moments or after physical activity? Facial flushing can be triggered by high blood pressure episodes, especially during emotional stress, exposure to heat, or consuming alcohol. It's caused by blood vessels dilating and blood rushing to the surface of the skin. While it's not always dangerous on its own, persistent or unexplained facial redness could indicate fluctuating blood pressure levels. If it occurs alongside other symptoms, it's time for a checkup. High blood pressure often creeps in without warning, but your body is smarter than you think. These 10 early signs are not just coincidences, they're signals. Don't ignore them. Regularly check your blood pressure at home, eat whole foods, reduce salt, manage stress, and get plenty of sleep. Prevention is always easier than treatment. And remember, you're not powerless. You're informed, and that's your first step to taking control. If you care about your long-term health or someone else's, don't miss this essential guide to the early signs of high blood pressure. Comment below if you've experienced any of these symptoms or learned something new. Like, subscribe, and share this video with someone who needs it. Let's build a healthier world together.